Hi, I'm Keith Bentham. I'm the IT Programme Manager working in Better Care Together, and I'm here today just to spend a minute or two just explaining about this new video link that we've helped to put in here at Millom Hospital in conjunction with Cumbria Health on Call.
Hello, I'm Dr Millom and I'm the Medical Director at Cumbria Health on Call. I'm a daytime GP in Glenriddin, down in Ullswater, and I do CHOC clinical shifts all over the county.
I'm Susan Blakemore, the Chief Executive of Cumbria Health on Call.
This is an extension of the service offering that's already provided by CHOC.
It's about a starting point for patients to see if we can manage their symptoms and manage their consultation quite near to where they live.
If they're not feeling well, the last thing they want to do is probably drive the 50 minutes to Barrow.
They access it in the same way as they would do ordinarily. They will phone 111 direct or they will contact CHOC.
The doctor at Carlisle will triage the case to see whether it's appropriate to be dealt with by telehealth.
They will be offered a choice, so they can say, well, you can come along for a video consultation with a CHOC doctor.
We have a GP based in Carlisle who can undertake a consultation with a patient in the community hospital.
And the patient is then invited into Millom Hospital, where they're met by a healthcare assistant.
So they have got a face-to-face contact and they have got a person there who will
take people's temperatures, blood pressures, and at the end of the consultation, in the event that there's been a prescription issued, direct the patient to the correct pharmacy. Or they can continue to have a face-to-face consultation with a CHOC doctor, but they have to travel to Furness General Hospital.
But we'll see people who can walk and talk with conditions such as minor illness, rashes, sore throats, earaches, that type of condition.
They don't need to travel unless their consultation or their symptoms indicate that they need to have further assessment.
So that doesn't preclude us getting in our car and coming over to Millom, or equally if they're that unwell, we may make a judgment on the telephone to call an ambulance. The skill of the system is selecting those patients that will benefit from this particular way of assessing their medical need. If we are asking patients to travel that far, then we know after our telehealth consultation it's an appropriate and a valuable thing for them to have to do, rather than just expect them to go without an initial assessment.
The feedback that we've had about the service to date has been excellent.
The consultation has gone extremely well.
Experiencing it and feeling the benefit.
People very quickly forget that they sat in front of a video unit and not in the same room as the clinician. We've even had one occasion where at the end of the consultation we've had one of the patients reach out and try and give a virtual handshake to the doctor.
For patients, our experience has been they are very comfortable with the technology. They're comfortable with the consultation. We have tested out the technology very, very thoroughly before implementing it.
We went live over a bank holiday weekend, and we had 7 calls from Millom residents during that time, and 2 out of those 7 resulted in a video consultation. Those patients were seen from the call being logged to the end of the call in 79 minutes, as opposed to 190 minutes for those people who had to carry on going to NHS premises or even have a home visit.
While I'm doing this video consultation, it frees up time of other doctors to see other patients, not just from Millom but from all the Furness area, who would otherwise have had to travel perhaps to Millom.
The resources they've got are being used more effectively.
So this technology is a real enabler for CHOC as an organisation, but for patients as well, to be seen locally and to have their care delivered locally.